This meeting is being recorded.
Okay, welcome everyone. This is the first session of our RaCEEs course, and I'm going to run this session today with my colleague Cath from the University of Lancashire. And we also got another couple of team leads today in this call, so I'm going to ask them to introduce themselves. I'm Valerio Benedetto. I'm from the University of Lancashire, and also I'm part of the Evidence for Equitable Decision Making sub-team as part of the ARC Northwest Coast. And as I was saying, I'm one of the team leads for this RaCEEs course. Cath, would you like to introduce yourself?
Hello, I'm Cath Harris. I'm an information specialist. I also work at the University of Lancashire and for the ARC.
Thank you, Cath. And as team leads, we also got Luis and Ryan. Luis, would you like to introduce yourself?
Hello, my name is Luís Filipe. I'm a lecturer in health economics in the University of Lancaster, and I will be the team lead with Ryan on the frailty theme. So nice to
Thank
meet you.
Thank you, Luis. And Ryan.
Hello, everyone. My name is Ryan Smith. I'm working as a major trauma rehab coordinator in Morecambe Bay at the moment, but I've got a master's in health economics, and I'll be assisting Lewis with the frailty group.
Oh, thank you very much, Ryan. There are another couple of team leads who are on leave today, Andy Clegg and Misael and Naya Montes. So I'm going to ask them to introduce themselves during the next session. But I will do a proper team presentation later on. I don't think we'll have time to do a round of introduction because there are a lot of participants today, but hopefully you will have a chance to speak to each other a bit more during the course and also at the workshop where you will meet each other physically face to face. So today is the first session. It's all about selecting an economic evaluation. So what we're going to do today is talk briefly about what an economic evaluation is, and then Cath will talk you through how to search for and select an appropriate economic evaluation paper. Before we do that, I think it'd be good to summarize what the aims of the RaCEEs course are. So first of all, we try to prepare and deliver this course in order to grow skills in health economics and specifically health economic evaluation across the ARC West Coast. We started this course, I think, 2, 3 years ago. So it was part of ARC 1, and now it's been delivered also as part of ARC 2. And this is the fourth cohort we have. So we had quite a few participants already from health or social care organization, local authorities, third sector organization. We had public advisors, a part of the ARC Northwest Coast. So it's been a quite successful course, and we had quite a lot of impact already as part of the course. So the first aim is to, as I said, grow skills in health economics and health economic evaluation, even if you don't have any prior knowledge around these disciplines. Then we will try together to give you the skills to critically appraise an economic evaluation. So today's session is all about choosing a paper, and then each one of you will work on that in the next couple of weeks. So you will have a chance to search for a paper, an economic evaluation paper in the literature, and then the team leads will coordinate the final selection with you, and that paper will be the vehicle to learn more about economic evaluations. But it's important that we not only take everything that paper says as face value, but we are also able to critically appraise the strengths, the limitation of that paper. And throughout the course, we're going to give you the skills in order for you to be able to critically appraise an economic evaluation paper. And it's not only important that we're able to critically appraise the paper, but also to build on the findings and expand upon the findings to form change in policy and practice if it's possible. The third aim is to try and produce and disseminate a publishable commentary on that paper. Okay, so we will try to do that as part of the workshop specifically. So that will be the final, let's say, session of this course. And we will try to interpret the economic evaluation paper and try to make a commentary, write up a commentary which could be published in an academic journal. So this is a kind of the pathway. So you'll all have a chance to choose an economic evaluation paper. Then the team lead will choose the one that is particularly appropriate for your team. And that paper will be a vehicle to learn more about economic evaluation. And then during the workshop, the teams will work on critically appraising the paper, and then hopefully there will be a published commentary out of that. Now, we can't promise you a publication because that would mean that we are lying a bit. So we can instead promise you that we can work towards a publication and making sure that you got a commentary there, which is co-produced by all people in the team, and that it can be then submitted for publication. So these are the aims. Is everyone clear with the aims? Do you have any specific questions for now? Okay. Now, just going to summarize the content of the RaCEEs course. You probably seen the content already summarized in email, but it's just good to refresh our memory around that. So session 1 is today, and it's all about formulating a research question and selecting an economic evaluation. Then session 2, 3, and 4 are all about methods. So once the team will have an economic evaluation paper, you will have the opportunity to delve into that and find out more about the key attributes of that paper, that particular economic evaluation. Find out more about the cost side, so how to look out for cost information within the paper, and similarly for the outcomes, how to look out for outcomes within that specific paper. Session 5 is all about the results. So that will be about interpreting the results from an analysis of an economic evaluation and trying to make some judgments and around what the results mean. And then session 6 is all about the introduction bit of the commentary, which we are going to produce together. So the introduction will mean understanding, for example, the prevalence of the problem or the specific clinical economic burden on patients or families and so on. So that will be something we will cover at session 6. So all these different sessions will give you bits of information that will help us writing up the commentary. So we will do a summary of the method of the paper, a summary of the results. We will describe the prevalence, the economic burden of a particular problem as part of the introduction. And then during the workshop, we will actually critically appraise that paper, and we will write up the commentary section as a result of the discussion that we will have during the workshop. So it is a gradual process where we will learn a bit more about each section during our future sessions, and then by the end of it, hopefully you'll have all the skills in order to critically appraise the economic evaluation paper. Today, we are going to cover a research question and selecting an economic evaluation. So we got 6 online sessions. Just to know that the session 2 is on a Tuesday rather than on a Monday, and it's going to last a bit more, just 15 minutes more. The remaining sessions are all on a Monday between 10 and 11 every fortnight. And then the final workshop is on Wednesday, the 2nd of September at the University of Lancashire in Preston. I will send you the exact room and more logistic details in the next few weeks. But I know I keep reminding people to do that. But if you haven't done so already, please accept or decline the calendar invites, because it will really help us with understanding the numbers, particularly for the workshop. We need to book things like catering, as you probably expect, and so we need to know the numbers, the definite numbers soon. Any questions so far? Okay, so I'm going to now cover the team's introductions. You already know the team leads, apart from, of course, Andy and Misael, but I'm going to give you also some more indication of the team's composition. So in the team 14, which is all about nutrition, we got Toib, Lula, Liz, and Emily Lovett. I think we got two Emilys. So Emily Lovett is in this team, and this team will be led by Cath. Digital Health team, we got Sean, Katie, Alia, Gillian, Lucy, Hannah, and Nicola. So 7 people here. Team 16 is Dementia, and there is Fiona, Megan, Chloe, Ollie, Rose, and Deborah. Team 17 is Cancer Care, and we got Jane, Karen, Michelle, and Rajin. And then lastly, last but not least, is Frailty team with Emily, Brian, Nima, Kirsty, and Annette. So as I was mentioning before, Cath is leading the nutrition team, Andy is leading the digital health team, I will be leading the dementia team, and then cancer care is led by Misael, and Luis and Ryan are leading the frailty team. Is everybody okay with this allocation? Have I missed anyone? I think if you want to mute yourself and say, no, or if I missed your name,
Hi,
please.
sorry, I was just grabbing a charger. Would you let me know which team I was on, please?
Katie, you are on digital health. So, okay.
Great, thank you.
Okay, fantastic. Anyone else? Any questions? Okay, so you all got access to a team space. We are going to put the slides there, the link to the recording, the homework documents there. And as I was saying at the beginning, you got a chance to use the chat function, for example, to interact with your teammates or your team leads. So if you have any questions, any doubts about how to do the homework, that's the perfect place to ask those questions. But yeah, this is just an overview of today's teams. I'm sorry we don't have time to introduce each one of us today, each one of you today, but I'm sure there will be opportunities to interact a bit more as part of the course. Now, I'm going to, before we start with the actual slides of today's session, I just wanted to give you some indication of what we mean with author's contribution. So I mentioned a few times that we co-produce this commentary together, but it's important that we, as a team, each one of us contribute to some extent to the writing up or to the review of the final commentary. So we're going to follow these 4 criteria, not very strictly, but we try to follow these 4 criteria in order to decide whether a person can be eligible for a co-authorship in the final commentary. So these are 4 criteria which are set out by the International Committee of Medical Journals Editors, whether people have made, for example, substantial contribution, they have drafted the work or they reviewed that work critically, whether they had a chance to do a final approval of the version to be published, and everyone need to be agreed to be accountable for all aspects of the work. So these are general criteria that in academia are followed in order to assign co-authorship of specific research papers. And as I say, we'll try, maybe not strictly, but we'll try to follow this criteria in order to make sure that everyone is eligible for co-authorship. Now, session 1. The aim of today's session is to identify a research question and select a suitable economic evaluation. So I'm going to cover very quickly what we mean with economic evaluation, and I'll do this quickly today because session 2 is we will delve into that a bit more in depth, so we will have time to understand a bit more about economic evaluations and their attributes in session 2. We will talk about the PICO framework, which will help us to define a research question, and Cath will give you a very good explanation how to search for potential economic evaluation papers. And then I will talk about the homework after today's session, which is all about selecting a suitable economic evaluation for the RaCEEs. Now, in the health or social care system, we all know that we got a problem with limited resources. This is not a problem which is specific to the health or social care system, as it is probably affecting all kind of sectors in the economy. So when we have limited resources, we need to make choices. We have a problem of allocating our resources. So as soon as we recognize that problem, we need to understand, okay, we need to make priorities with the resources available. Could be financial, capital, human resources there. And we need to understand that there is something we are giving up. As soon as we make an investment, as soon as we put some monies in order to treat a specific patient population, we are giving up something else, and that is the opportunity cost. So this is to give you a graphical depiction of what's going on in terms of making specific choices for specific treatments in the health or social care sector. There's a problem of scarcity, but there's also a problem of recognizing that we are giving up something, we are displacing some existing resources from existing treatment, for example. So we need to be aware of that. We need to be aware of the opportunity cost there. And this graph is here in order to depict some key concepts that we are going to cover as part of all the session: concept of scarcity, concept of choice, concept of opportunity cost, which are really key in health economics, but in economics more widely. And this is another simplified diagram of an economic evaluation. So here we got the choice between two alternatives, alternative A and alternative B. Of course, you can have more alternatives out there. So this is just a simplified example. Alternative A might be a new drug, a new type of surgery, a new treatment, a new intervention in general. Alternative B could be the standard of care, for example. And we're trying to understand in an economic evaluation what the cost will be for alternative A, what the consequences will be for alternative A, like the benefits, the outcomes, and similarly the cost and consequences for alternative B. And we're trying to do a joint analysis of cost and consequences in order to understand, okay, if we go with alternative A, what are we giving up? What would be the opportunity cost of alternative B, for example? If we were to, invest more money in alternative A, how many benefits are we going to obtain from alternative A? Are these benefits worth the cost of alternative A? So these are all key questions which we need to understand in order to delve into the choice of alternative A versus alternative B in this particular example. And throughout the RaCEEs course, we're going to cover, the costs, the consequences, how to interpret the results of the joint analysis in order to give you all the skill set that you need to interpret the results from the economic evaluation. Now, this is to give you a brief overview on economic evaluation paper, of an economic evaluation. Now, in session 2, as I said before, we will give you more descriptions and indication of the key attributes of an economic evaluation. But for now, I wanted to ask you to take a minute and write down a particular research question you're interested in. So according to your interest, your clinical or any interest you got, what research question would you like to pursue as part of this course? And then I'm going to give you an example on how to use that research question in order to search for potential economic evaluations in that area. So if you can take a minute and write down your research question. Thank you. Okay, does somebody want to unmute themselves and just talk about the research question they wrote down? Somebody very, very brave at all, no? Otherwise, I'll give you an example here, okay?
Well, and I'll have a go,
Oh, okay,
Valerio.
Zillian, fantastic.
So
Yeah.
I want to sort of, my question is sort of an evaluation of the impact of the use of 3D digital technology to facilitate discharge of frail elderly people within sort of the Barrow, South Lakes area.
That's very good and already very specific in terms of the patient population. So this is really, really good, good research question, in my opinion. Yeah. Thank you, Gillian. Anyone else?
Yeah, I'd be happy to share. So,
Yeah.
a couple of kind of wider programs that we're trying to do in our innovation team at the moment would be around either looking at how can a procedure delivered in outpatients deliver financial benefits to an organisation compared to delivering it in theatres, or similarly, how can minimally invasive procedures deliver financial benefits compared to being delivered in kind of a traditional invasive method.
Okay, no, that's really good. Thank you, Katie. That's really good. Anyone else?
I've got one.
Yeah.
So something around does an active ward model led by trained clinical support workers increase daily mobilisation while patients are in hospital and reduce length of stay?
Okay, that's fine. No, that's really good as well. No, thank you, Emily. So I think you come up with really good research questions, all of you. So that is going to make things easier when you're going to look for a proper economic evaluation later on as part of the homework after today's session. The example you can see here is an example which relates to stroke care. So it's a physical exercise program cost effective in improving cognitive function for patients with stroke. Now, the PICO framework is the framework which tries to disentangle your research question into different components. In particular, PICO stands for population, intervention, comparison, and outcome. And we are going to use this PICO framework because it will help you in order to formulate the search terms as part of your search strategy, which you will use to choose an economic evaluation paper. So if you think about the research question you see there in front of you, you got different components. For example, population will be adults with stroke. Intervention will be physical exercise program. There is no comparison in this question, but as we heard from previous research questions, you could have a comparison, for example, and that's of course very good. So you could have something to fill in there. The outcome will be cognitive function. So you can see that we disentangle the research question into different components, and that will help us to define the search terms. In particular, adults with stroke, that means we are going to concentrate on search terms like stroke or cerebrovascular disease. Intervention is a physical exercise program, so some potential search terms here will be physical activity, exercise. Comparison, there's no comparison, but again, there'll be a similar process where we can try and formulate some search terms here in case we had a comparison. Cognitive function is the outcome, and again, there's a couple of search terms here like cognitive and cognition. So the PICO framework in this particular example, but also in other examples, it is helping us to understand, okay, we got a research question, how can we define some key search terms that we are going to use as part of our search strategy. And Cath now will talk you through how to formulate the search strategy and search for a potential economic evaluation paper. Cath.
Great. Shall I share my screen?
Yes, I'll stop sharing. Yeah, that's it.
Slide. So as Valeria's explained, we've broken down our search question and into sort of the components of the question that we want to search for, and we've thought about some different terms that might be used to describe that concept in the literature. So once we've done that process, the next step is to put those search terms into a search strategy. Now, there is more than one way to conduct a literature search, and there are more complex techniques that can be used. But today we're just going to look at doing a very simple search using a search string to identify some relevant literature. So when we're putting together a search string, what we need to do is we need to use some operators. They tell the database how to combine the search terms and execute the search to retrieve what we want it to retrieve. And we also need to use brackets. If we're using a single search string and we have more than one concept, it's a bit like when you have a maths equation or an algorithm, you need to group your terms together and use brackets to tell the database to search for those terms together. So we will combine the synonyms or the alternative terms for each of the concepts using OR. So OR tells the database to search for either of the terms that we enter in. So if we did a search for smoking or tobacco, that will retrieve titles and abstracts that have either the word smoking or the word tobacco in them. So OR is more. And then so we will have OR in between each of alternative terms, and we will put each cluster of terms within a bracket. Then in between each cluster, we're going to use AND. So AND tells the database to search for all of the search terms. So if we searched for smoking and tobacco, that would retrieve abstracts that have both of those terms in, so both the term smoking and the tobacco. And it will make a bit more sense in the next slide when we have a look at the full search string. Another tip is that if we have a search term that is more than one word and we want to search for that as a phrase, we'll put that in quotation marks to tell the database to search for that specific phrase. So for example, physical activity, if we didn't put quotation marks around it, it would still find the results, but it would find physical activity anywhere in the abstract. So you might get many more irrelevant results than if you put that in quotation marks to search for it as an exact phrase. If you've only got one word in your term, like stroke, you don't need to put that in quotation marks. It's just if you have more than one word and you're looking for a phrase. So I hope that all makes sense. So this is what it would look like. So in our example, we have our population terms. So stroke or cerebrovascular disease, those are in brackets. So that's our first concept. And cerebrovascular disease is in quotation marks to search for that as a phrase. Then we have and physical activity or exercise, which are our intervention terms. Again, they're together in brackets. And cognitive or cognition, which are our outcome terms. And then we have a couple of concepts which relate to economic evaluations. So this is to limit our search to economic evaluations and hopefully filter out some of the other study types that are not relevant to us. So we have and cost or price or expenditure or expense, and economic evaluation or cost effectiveness. And the slides will be shared, so you can have a look back at this slide and copy those search lines into your search if you want to. So now I am going to go to PubMed. So I'm going to demonstrate a simple search in PubMed. Can you still see my screen, Valerio?
Yeah.
I'm sure most people are familiar with PubMed. It is a free database platform produced by the National Library of Medicine in the US. It contains indexes for life sciences and other online books, but very importantly, it gives us access to Medline, which is sort of the main healthcare database, and it is freely available. So no matter where you're based, you'll be able to get access to this. If you do have access to other databases within your organisation, the search string will work just as well in those. So if you wanted to try searching in other databases, that's absolutely fine too. But we're just going to demonstrate PubMed today. So you can see from the homepage, it's a nice sort of Google style search box in the middle of the page. There is an advanced search function, which we're not going to look at today. We're just going to do a simple search, but that is there. And so what we'll do is we will just copy and paste our search string into the search box. Oops. Okay, can you see that still? Yep. So we've
we can see, yeah.
You can see how the search string looks, all in one big string. We've got our intervention terms, outcome terms, and we've got the economic evaluation terms. So there are 16 results that match that search. We can see in the middle of the screen, we have our list of results. And we also have some filters to the left, so we can filter the results if we want to. Probably the most useful filter is the date filter. So we do recommend that you try and find something from within the last 5 years, if possible. And that just makes it easier when we come to try and publish the commentary, that we're looking at something that's quite recent and quite up to date. So we can either filter by the publication date here, or we can use this little slider and just filter the results to sort of since 2020. You can see that's reduced my results from 16 to 7. So now I probably want to have a read through the title and abstract and see if any of these are relevant. So I'm just going to go through a few of the results. It's not always really easy to spot when a paper has an economic evaluation study design. So I'm just going to show you what kinds of results you might get and which are relevant and which aren't. So if we have a look at this first one, if we click on the link, we can get the full title and abstract. So this first result is it's a systematic review, it's a Cochrane review. We can already see actually it's not hugely relevant. It's interventions for preventing falls. It's not specifically in stroke patients, and it's not an economic evaluation. It's a systematic review. It's probably got the words cost effectiveness somewhere in the discussion or in the conclusions of that abstract. So this paper is not relevant to what we want. There's a little button here to the right-hand side, so we can sort of tab through the results. So if we go to the next result, this one looks a lot more promising. So you can see from the title, this is an economic evaluation. The intervention's exercise, so it's the correct intervention. It's in stroke patients, and it's looking at improving cognition. So this looks absolutely perfect for what we require. And if we look at the objective is usually quite a good section of the abstract to look at. We can see the objective is to conduct a cost effectiveness and cost utility analysis. So this is definitely an economic evaluation. But we'll just look through a few more results. This next one, this mentions economic evaluations in the title, but we can see it is a systematic review. So this is a systematic review of economic evaluations. And again, this wouldn't be relevant for us, and you may see this in your results when you search for these kind of terms. But yeah, this is a systematic review of that study type. It's not in itself a cost effectiveness analysis. So this would not be relevant for our project. The next result, again, it's mentioning cost effectiveness in the title. But if we read a little bit further, we can see it's a study protocol for a randomized controlled trial. So a protocol is sort of a plan that's made before you start a research project, usually a systematic review or a trial. It's not the full paper. So again, not relevant to what we need. And we'll just look at one more. This paper is sort of discussing instruments to estimate quality adjusted life years. So it is about economic evaluations, but it's a methodology paper. So it's looking at the instruments that are used in economic evaluations. It's not in itself a cost effectiveness analysis. So hopefully that's helpful to sort of see what kinds of things you might get back when you do a search. So if we go back to our search results, there's just a little button here. We can get back to the list of results. I think number 2 was the most relevant. So once we have identified a paper that we think is a good one and is suitable, what we want to do is try and have a look at the full text. So in PubMed, to the right-hand side of the abstract, you'll see there are full text links. And very luckily for us, this paper is open access. So you can see there's free full text available either from PubMed Central, which is like a repository of papers, or indeed from the publisher themselves. It's available open access. So if you click on that link, we can get access to the full paper and download the PDF. If you find a paper and it's behind a paywall and you don't have access to it through Athens or your sort of organisational subscriptions, if you just let us know, we'll try and get hold of it for you. Go back. Okay. So that's running a search in PubMed. So if just a couple more tips on refining your search. If you do a search and you're just finding hundreds of results and it's too many, it's overwhelming, let's say you find more than 100 studies, you could add additional terms to sort of refine your search and narrow it down a bit. So you could either add another concept. So for example, if you had a comparator, you could add some terms with "and" for the comparator. So I will say here that the more ands you have in a search, the more focused a search will be. The more ors, the more terms you have combined with or, the bigger the search will be. So often it's kind of a balance between the ands and the ors, having enough search terms to find the relevant papers, and not having too many concepts that you make the search too narrow. So yeah, so if you could add some additional terms to narrow down the search. You could take out some of your synonyms and alternative terms. So if you've got like a very broad term, you could try taking out one of the terms. So for example, instead of searching for stroke or cerebrovascular disease, we could just search for stroke, which is really the main term for that condition. Conversely, if you do your search and you're not finding anything, you can't identify any relevant economic evaluations, you might want to remove one of the variables, so remove one of the ands. So for example, we might remove our outcome terms and just search for the population and the intervention and the economic evaluation terms. Or we could add in some synonyms for the concepts. It might be that we've missed sort of a key term that's used to describe one of our concepts. Okay. So as an example, first we might try a simple search string like stroke and physical activity. That will produce about 5,000 results. So that's definitely too many to look through. So then we might try and add the outcome to the search string. So we search for stroke and physical activity and cognitive. That reduces our number of results. We only find 607, but this will also include sort of clinical studies as well as economic research. And because we're specifically looking for an economic evaluation, we want to refine that a bit further. And then we tried our full search string as we did before, and that sort of only returns ones that have the economic terms in, and we only had like 16 results. So that's just an example. Okay, I'll now hand back to Valerio to talk about selecting a suitable economic evaluation.
Thank you, Cath. Any questions for Cath? Okay.
Very good. Not a question, I suppose, just so there's a bit of feedback. So yeah, really good, Cath, really good. You've explained doing literature review in a very nice way and systematically, so thank you. It's not a question, just a bit of feedback.
Oh, thank you. If anybody does have any questions, please feel free to just drop me an email afterwards. You know, if you get stuck or anything, just let me know.
I have a question. Would it, the systematic review one that you found, would it be useful to go through the papers that were part of the systematic review?
That is a good point. Yes, that would be a good way to identify some potentially relevant results. Yeah, so if you find a systematic review, definitely have a look at what papers were included and if any of those are relevant. As I say, you're just wanting to find something that's quite recent. Keep in mind that you're wanting to find something quite recent. And yeah, I suppose, yeah, just the actual systematic review itself wouldn't be appropriate for our RaCEEs project. But yeah, no, definitely, that's a good point.
Thank you, Cath. Any more questions? Great. No, thank you again, Cath. Actually, leading from that point about systematic reviews and maybe finding more than one suitable papers, as Cath was explaining, like reading the abstracts is really good. Is a really good suggestion because you can have a bit more understanding what the economic evaluation is covering. But if you find maybe more than one suitable economic evaluation papers, you might want to look at the full test as well in some cases to get more info. And I don't mean reading the full article, but maybe just screen the full test. And this is a mini table of criteria that could help you in terms of determining, okay, this economic valuation might be slightly better than another. So if you got more than one candidate, you can have a look at the 2 or 3 economic valuations and understanding whether they're relevant to your search question. Do they have a clear focus? Are they easy to understand? The findings are relevant, are they applicable to practice? Was the economic evaluation published in the last 5 years? As Cath was mentioning, this is a really key point because we want to work on something that is fairly recent. And the more yeses you got to this question, to this criteria, the better it is, of course. So that this table, in a way, can help you making a final decision if you got more than one candidate. Okay. Here we got, again, to complement what Kat was saying about how to understand whether a paper is an actual economic evaluation or not. Here we got some examples from previous cohorts. So I'm going to show you some, let's say, mistakes first, and then I'm going to show you some good examples of economic evaluation papers. So this one, for example, is mentioning cost, resource use as part of the title, which are of course economic terms, but we do want a cost effectiveness or economic evaluation. So we want a joint analysis of costs and outcomes. In this case, this paper in particular is only focusing on one side of the problem, just the cost side. So it will not be appropriate for our RaCEEs scores. This other example here is about the state of music-based intervention for mental illness. You see that, yeah, we got the concept of value could be attributed to the economic discipline, but apart from that, there's not much linkages to economic evaluations or cost effectiveness analysis. So that will not be suitable for the RaCEEs scores. Instead, this is an example of a paper which some of the teams worked on before as part of the RaCEEs course. This is actually that was Cath's team. She worked on this paper, which was an economic evaluation of patient-directed music intervention for ICU patients receiving mechanical ventilatory support. I shouldn't say that, but as soon as you say economic evaluation, probably that's a good is a good clue that you're actually dealing with a good paper, a suitable paper in virtually all cases. That's according to my experience, but I would also have a look at the abstract just to double check that it is actually economic evaluation. So yeah, usually when I see a title like that, I say yes, it's good, but do have a look at the abstract to make sure that it's actually an economic evaluation. So that would be a good example. Another good example is the last one here. I think Luis worked on this before, cost effectiveness or real-time continuous glucose monitoring to target glucose control in preterm infants. Again, you got the term cost effectiveness, so that you got an understanding that there is a joint analysis between cost and effectiveness, so that's good. And again, if you have a look at the abstract, you find again more clues that this is actually a good economic evaluation to work on. Of course, these are all different topics, different health areas, disease areas. So for your own topic, you'll have to go through the search strategy, as Cath was telling you before, and try to find economic evaluation which are relevant for your topic area. Any questions? Okay, so I'm going to talk about the homework. So today's session, as I was saying, and as Cath was explaining, is all about searching for a potential economic evaluation paper. You got two tasks, and the first one is to search and select a suitable economic evaluation paper based on your team topic on PubMed. And the second one is to simply write down the title and paste the link to the economic evaluation in a Word document on Teams. So each one of you will have to do this task in the next week or so, and try to find a suitable economic evaluation and then copy and paste the link to the paper on Teams. I'm going to show you also the document on Teams in a minute. And we're going to ask you to complete this task by next Tuesday, so after bank holiday weekend. I'm going to send you a reminder this week, but this is not school, so if you don't have the time, don't worry too much. As I was saying before, these are all homeworks that we put in place in order for you to understand more about health economics, health economic evaluation. So if you got the time, that'd be great, but we know how busy you are, so if you don't have the time, don't worry too much, okay? But we will remind you during the week about doing this homework. And then, of course, each one of you hopefully will have an economic evaluation paper, will choose an economic evaluation paper, but of course the team as a whole will only work on one economic evaluation paper. So the team lead will then choose the most suitable economic evaluation paper. So for example, the nutrition team has got 4 members. You'll have, hopefully each one of you will choose an economic evaluation paper. So Cath will choose among a set of 4 papers, and then she will choose one that you are going to be work on as part of the RaCEEs course. Now, there might be some disappointment, of course, because we'll have to choose only one, but try to think that that paper will be used as a vehicle to learn more about health economic and health economics evaluation. So if you're really interested in developing a RaCEEs around that particular paper, even if it's not been chosen, we can talk about doing what we call a fast track RaCEEs after this course. So there is always a chance for you to work on your preferred paper if you want. So on Teams, you can find the documents for your homework by clicking on session 1, selecting economic evaluation on this folder, and then you'll see the Word document. It's called session 1 homework. And if you open that Word document, you will see your name at some point in the document. You can just write the title of the economic evaluation and then paste the link to the article. Okay. So this is the homework and how to complete the homework in the next week or so. Any questions? Okay. So that's it for today, and I hope you enjoyed this first session. And if you do have any questions for me or for Cath about how to search for an economic evaluation, please do get in touch. We are more than happy to help you with your searches. And otherwise, of course, we'll be in touch about selecting the economic evaluation for your team. Otherwise, yeah, we will see you at the next session, which is on Tuesday, the 2nd of June. Thank you very much, everyone.
Thank you.
Thank you.
Thank you. Bye now.
Thank you.
Thank you.